Was there, probably received a lot of advice, friends, family members. What do you think was some of the best advice that you received and what you could tell other caregivers to use if they're caring for, a child or, somebody young with cancer?
I think the biggest thing is, well, for us, because we had a strong faith and a strong relationship with our church, that was something that we could really lean into. And I'm aware that not everybody has that, but I guess I would tell young families that if you have a support system, it's kind of like pay it forward a little bit, because our church was an incredible resource for us, not just in their prayers, but their on-the-feet action.
Doing work for you and like helping you along in the journey.
And food was a huge issue when you have 5 children.
3 boys.
Right. Trying to make sure that meals were prepared and nutrition is very important. And so having that support system in place.
Do you have any advice? You went through this when Taylor was young. Do you have any advice for caregivers in similar situations? Let's say somebody else whose child is in school or college or something. What kind of advice would you give to caregivers when their kid calls from an emergency center and says, I have a mass? What are the learning points that and we've touched on these before, but just together, what were some of the learning points that you used?
I think the main one is to ask all the questions that you have. Continue to politely push. We've always taught our children to respectfully question authority. And I think that's a big part, is that you've got to find a way to ask the questions that you want. If you don't understand, to be able to say, that was way over my head, do you mind saying it again a little bit simpler?
I think that's a great point. So Taylor, tell me, how important is your self-education and self-advocacy in the cancer journey? How important do you think it is for you? How important do you think it is for other patients going through this?
Oh, incredibly important. So, I think that knowledge is power, and so the more educated you can make yourself about what you're going through and your support team about what you're going through, the better off you're going to be. And so I think that the majority of cancer patients in this country are treated in a community oncology setting. And so, oftentimes that's great care, and it's where you get care. But I don't think that there's any harm in, educating yourself about the latest and greatest research that's going on within your diagnosis, being aware of genetic and molecular testing, going for, aggressive treatment if that's the route that you want to go, and, asking your physician questions that he might not bring up for one reason or the other, and just, being comfortable and confident in the knowledge that you can build so that you can get the best care possible.
Wow, Nancy, you must be really proud of Taylor. I think she's really touched on that point. So Taylor, what else did you, resources-wise, did you think about, have you changed anything after your cancer journey as far as nutrition is concerned, exercise is concerned? Have you changed anything since you got diagnosed?
So obviously I'll never be a Division I college athlete again, and that's okay. It's been interesting to kind of find a new normal in terms of fitness for me, because I used to work out a lot and really hard, and I can't do that anymore. So I still, am very active and have found things that work for me. And so I'm learning to play golf. I started a running group. I love
a running group.
Yeah.
Nice.
Yeah, we run at 5:30 in the morning.
5:30 in the morning. Oh, okay, yeah. Not joining that group. So.
I like to be on the water, but overall, I think I just make better health decisions in general. I was always health conscious just because of being a Division I college athlete. You don't have much of a choice. But just trying to make sure that I stay active, even if it's just walking or taking the stairs one time. But just finding things that I know will make my life better at the end of the day.
So the running club, is it like a 5K, a marathon running club, or is it like
we run
something
for
which other people can
an hour every morning, and it's like a run-walk matrix. So I wanted, my neighborhood, it's in my neighborhood, and I wanted to start it for people that were not fit, because I think that's one of the most difficult things for people, is that they're intimidated to walk into a gym because they're out of shape, or to go get on the treadmill because it's scary. And a lot of running clubs are, people that are running 6-minute miles. And so they don't want to go to that because
Right.
clearly they're not running the 6-minute mile. And so this club was really for the people that were extremely out of shape. So we started initially where we did a 4-minute warm-up where we just walked, and then we ran for a minute, and then we walked for a minute, and then we ran for a minute.
So intermittent training and everything.
Yes, and so we've worked up, and now we're running for about 18 minutes, and then walking for a minute, and then we go back to 18 minutes, and then a minute.
That's very impressive. Maybe I
So-
should move to North Carolina
Yeah.
and do the out of shape and start running like 2 minutes and then walking like 10 minutes. But tell me this, Taylor. What do you think is the most important message you have for patients, caregivers who are experiencing a cancer diagnosis, especially young adults who get diagnosed with cancer? What is the most important message you have?
I think to educate yourself as best you can about what you're going through and to be an advocate for yourself. So the healthcare system is complex.
That's the understatement.
Yeah, that's an understatement. There are more and more people being diagnosed with cancer, and it is important for you to be knowledgeable about your disease and to be able to ask questions and to advocate for yourself. And if something doesn't feel right, speak up.
So go ahead and so what you're saying is, and keep your records with you. Always
Yes.
keep a great record keeping
Yep.
and everything with
so
you.
keep your records, never go to an appointment alone. Find ways to communicate with your friends and family because oftentimes...
Ask for help.
Yeah, ask for help. I think, the communication is key because friends and family sometimes don't know, like, should I bring it up? Should I not bring it up? What should I say?
Awkward silence.
Yeah,
right?
yeah. And so I think if you are comfortable kind of being open and honest about how much you want to discuss or how much you don't want to discuss so that your friends and family, know kind of what you want.
I think that's a really important point because sometimes people don't want to talk about it,
Right.
and they're like, they don't want to offend you, but it's open to be outright with their diagnosis saying, hey, we both know I have lung cancer, and we can talk about it.
Right.